all wish COVID was behind us, right?
Yep, I thought so.
But I mean, you're also on a medication that, I guess even if you were, have you been getting any vaccines, boosters, that kind of thing?
No.
Okay. You're on a medication that can interfere with your ability to benefit from the vaccine, for the CLL, the one
Yep.
you're taking.
Okay.
It makes it a little harder for your body to process the vaccine anyway, so you're higher risk no matter how you cut it. But still, I think the vaccine can provide some benefit. Not today though. So we, at this stage, if you were to have persistent COVID infection, I mean, if we were to say trust the test, the testing can be used as a means of monitoring the infection, because eventually the antigen test will clear, and at that point certainly we can be confident that you're no longer infected,
Right. Okay.
at risk of spreading the virus. It won't change our treatment for you, or what based. It's more as a kind of an awareness as to when you should stop your own kind of isolation measures.
Yeah, it's not really isolation. It's just that I don't really see anybody what my life is all about,
Yep.
except I mow lawns, ride a bicycle, I go to the bank once in a while, I'm outside the window, the drive-in window.
Yeah, so I think because you're at risk for having a longer period where you may remain infectious, this using the testing as a guide for when you can stop your isolation precautions or wearing a mask, and I guess I'm referring to any time you are going out in public or to inside areas where you might be at risk of coughing and spreading the virus, you should wear
a mask. Yep.
preferably an N95 like this. I can try and hand some to you on your way out,
Okay.
so that you have that extra precaution. But yeah, it may be that you're no longer infectious even now, because
Okay.
the positive testing can linger. But it may be our best guide in the end, based on your elevated level of risk for prolonged shedding of the virus.
Okay. All right.
But in the meantime, as far as treatment is concerned, we'd be focusing on treating the symptoms. You would not require a repeat course of Paxlovid, or there's no recommendation for that. Does that make sense?
Yeah.
Okay. Okay, so tell me about the symptoms you're still dealing with.
Headache,
Okay.
cough every once in a while, but it's just a little kind of, when I'm on the phone with my daughter or something, it's while I'm talking, I kind of, and the side of my head's clogged. The left side of my head's clogged.
Okay, like
Yeah,
your
I
ear feels plugged up, or?
Well, my ear is plugged up.
Okay.
Not bad, but I can still hear a little bit through it. But I always, when I'm mowing a lawn or on my bicycle, I wear a headbutt. And this one works.
Yeah.
And this one doesn't.
Okay.
Very seldom, very little.
And that's new?
Yeah, but I can breathe through my nose, no problem.
Okay. Any sore throat?
Little.
And sorry, I know I asked before, you're not having any fever till now,
No.
but were you before?
No.
And did you say symptoms are gradually improving, the cough and such?
Yes, yes. Yeah, I'm not coughing up as much as I did a week ago.
Yeah.
Very little.
Yeah, so for a typical case, you are at the point where we would typically say you don't need to continue precautions just because you're not having a fever anymore, your symptoms are improving.
Yep.
So,
Oh, these
again, it's hard to
these
know
were
how
my
to
results last week at Express Care.
What's that?
These were my results at Express Care last week, same thing.
What are you pointing to?
You know, this,
Oh, yeah. So no, yeah, right, we know that you haven't had a fever when you've been in
Right,
clinic, but
right.
sometimes the fever can come and go, and so I just wanna make sure you weren't having any like, chills or
Nope.
sweats or
Nope.
or check your feet,
none of that.
temperature at home, like that. All right, so, so yeah, although you've had some symptoms that are lingering, the fact that they're gradually improving is pretty reassuring. And of course, you haven't had any big whopping, severe pneumonia or anything requiring hospitalization.
No,
So I do feel like we have to take the persistent positive test with a grain of salt.
okay,
Um, and it's really gonna have to come down to, whether we want to use the test as a means of guiding your isolation precautions, mask wearing and such. Because, especially if you had somebody at home who was high risk, or if there were a lot of people at home that were worried about, getting COVID from your case, or if you had, say, a big family reunion coming up, or some big event of travel that you were planning on, I think it would be certainly best to take the extra precaution of
Oh.
using the testing.
well, that's where I got it from, was I went to Arkansas with my wife,
Okay.
and all along going from Hartford to O'Hare, and going into O'Hare Airport with thousands of people around, and then bringing it down to Arkansas, because my sister-in-law and her daughter got it. I don't know how severe their cases were, if anything, but they got what I had, and I didn't wear a mask, which I should have, and just didn't think of it at the time. But yeah, I'll wear a mask wherever I go now. My wife will let me
Okay,
go
great,
out.
yeah, I mean, and so it's just a matter of, certainly you can continue to wear a mask until your symptoms resolve, that's one way to, so we've got three different approaches here. One could argue that you might be able to stop wearing the mask now based on the fact that you're not having fevers, your symptoms have been steadily improving, and although they've been lingering, they've been improving. So either end precautions now, or we could use the testing as a means of monitoring, like, each week to see and once the testing clears, we can be confident your infectious risk is low. Or we could say, continue to mask until your symptoms resolve. And, those latter two options would be probably the safest bet, but, I think that the extra effort of the testing would probably only make sense if you had something coming up. If you were going
No.
to a major family event or travel,
Right,
and you really were like, look, do I need to wear an N95 mask during this family gathering to prevent spreading to other folks?
well, I'm
And then-
not thinking of that, I'm thinking of getting something from somebody else, that's why I would wear a mask.
You would wear a mask, okay. You certainly wearing a mask in that setting is an option just to prevent any further infection of anything else. But yeah, I guess as far as preventing spread from your case to other folks, we've got a few options for how cautious we want to be. And
Okay.
it can depend to some degree on what your plans are. So do you have anything coming up in terms of travel or
No.
big gatherings?
No,
All right.
no, my big gathering was going to Arkansas, and I'm not gonna do that again,
All right,
cause you don't have a 75th birthday
all right.
but once.
And you go to anything like regular events like church where you're
Nope,
singing in front
No.
with a large crowd?
No.
You know?
well, I don't even go to
You're not in-
Walmart anymore.
You're not in the choir, okay. So it just, I think perhaps we don't need to go as far as doing, weekly testing or anything like that
Okay.
to make sure it gets cleared. But that is available. If you're finding that your symptoms are lingering and you do have plans coming up, you can ask to be tested. But if they
Ah.
continue to resolve, then
Okay.
that's pretty reassuring.
My wife has some COVID tests, home COVID test. I don't know how many she has left, cause she
That's
had a
fine.
bunch of them.
Yeah, so you can check their expiration dates,
Okay,
cause they do expire. They should be okay. There was a lot of controversy about the expiration dates because it became clear that, we're in the middle of a shortage. We have a bunch of tests that have expired because they were only permitted up to 3 months, but we later found out that those tests were perfectly fine up to like a year or 9 months.
okay, okay,
And so for a while, you could actually go online, even though you had an expired test, you could go online and check to see if that expiration date had been extended. But that was years ago. Hopefully that controversy has resolved itself, and you can just use the expiration date that's on the
Right.
box.
Right.
Okay. So what are you taking for your symptoms currently, for the cough and the,
Well, I take the inhaler.
yeah? What about the cough medicine, like Robitussin?
Right, I have, cough medicine,
Mhm.
a small little oval pill, I don't know what the heck that is, I can't remember. And they gave me 5 pills to take, 2 the first day and 1 each day afterwards.
Right, sorry. So, but you finished that, and the inhaler, but then, I thought they also gave you a cough syrup,
Yes,
and have you been using that?
yes,
Because I do feel like that is perhaps the highest yield thing as far as the cough's concerned. With COVID and with any upper respiratory infection, even once you've cleared the virus, you still have a lot of residual inflammation in the throat that'll take a while to go away.
okay,
And in fact, as long as that irritation is there, it makes your cough reflex and your gag reflex, everything's much more sensitive.
Right.
Okay?
okay,
And so even, going from hot to cold or from cold to hot, like, everything's much more sensitive. For folks that have allergies or even don't have allergies, they might find suddenly they're reacting to pollen more than they used to because of the increased sensitivity in when that inflammation is lingering. And then when you are laying in bed, post-nasal drip, any
Right.
normal fluid that drips back there, boom, it triggers a bout of
exactly,
coughing.
exactly,
And it's because everything's so much more sensitive. And unfortunately, with all that coughing, it might kind of create a little more irritation
right,
and kind of propagate this inflammation. Takes longer to resolve. So I do think it's good to take a cough medicine. The one they gave you, Robitussin DM, or it's also guaifenesin DM. Essentially, it has 2 medications in it. It's one that makes things more thin, easier to clear out, so you're not dealing with thick stuff that's hard to
Okay.
cough up.
okay,
And then the other medication is a cough suppressant. It kind of decreases your cough reflex a bit, and I think that's a huge benefit too. So you're just not coughing all the time.
right,
Um,
yeah, I'm not,
And you're not coughing all the time now.
No.
It's gotten that much better.
yes,
Okay.
oh.
What about at night? Do you get a lot of coughing at night?
Nah,
No
the
big
most
deal?
coughing I get, cause I take a trazodone, it puts me out,
Oh, okay.
so probably about 4 o'clock when I have to get up to pee, I'll get back to bed and I'll cough a little bit.
Okay.
I'm a side sleeper, so it just makes me cough just a little bit, not half as much as I was
So
doing.
cough. Okay. So cough is worst at night, would you say?
Not really, it's only, like I said, when I get up to pee, I get back to bed and it's,
Okay.
stand up.
All right.
After I've been sleeping on my side for all night long, then all of a sudden, a couple of those.
So I can take a look in your ear. One of the things that we have in mind when you've got all that inflammation in your throat, there is a connection
Yep.
between the ear and the throat.
Right.
The eustachian tube, which acts as a pressure valve for the ear, for the drum of the eardrum. The air pocket that's behind your eardrum.
Yep.
That needs it needs a pressure valve to equalize pressure. So if your throat gets irritated, that valve, that tube,
Okay,
might not open the way it's supposed to.
okay,
So, for that, I'd say we want to try and bring the inflammation down in the throat. It might help to take like an anti-allergy pill, something that just calms down the inflammation.
Zyrtec?
Zyrtec is an option.
Oh, okay.
Do you have that?
My wife has some of those.
Yeah, she can take some Zyrtec.
Okay.
And that's like a non-drowsy anti-allergy pill. You take it once a day, and it may help bring things down a bit.
Okay, cause
Okay.
I've just taken it like once in a while, I think I've had 2 so far in the last month.
Yeah, right. Well, if I just take a look. Any pain when I pull?
No,
Yeah, clear as a whistle. I don't see any signs of inflammation
Okay.
there.
Well, the nurse.
You don't put Q-tips in there or anything, do you?
Yes, I do.
Okay, don't do that.
Well, I went to one doctor 2 years ago, my primary doctor, and he said, how do you clean your ears? I says, Q-tips. He says, they're perfectly clean. He says, but don't use Q-tips. But my ears are perfectly clean.
All right. So the issue here is that is twofold. One, I mean, if you're using the Q-tip to get rid of earwax, the earwax is there for a reason. It helps protect the ear canal, and the ear canal is actually a pretty delicate environment. Even though the Q-tip is soft and clean, it can be like sandpaper.
Right.
And if you do irritate the lining of the ear canal, it can become very hard for the ear to protect itself. And
Oh.
and what I mean is that it needs to protect itself from the natural bacteria and yeast and whatnot that's on your skin.
Okay.
Because that stuff that's on your skin, it's always there. Your skin keeps it in balance, but it loves to overgrow in areas that are warm and moist, and so that's why we get like jock itch and athlete's foot, because
Yep.
the areas that might become moist
Right.
and wet for a
Right.
while, all of a sudden you get overgrowth of the yeast and fungus that's on the skin, and it can turn into a situation where as soon as it overgrows and irritates the skin is that much warmer because it's inflamed, and a little moister because of this swelling and whatnot. So so then we need to treat athlete's foot and jock itch with an antifungal to kind of bring things back into
Yeah.
balance.
Okay.
In your ear, the earwax creates a hostile environment for any of overgrowth, and so you want the earwax there to protect you. Of course, if it's too much and it starts to block things, that's another story. We want to clear that out, but otherwise, the small amount is good. And then again, if you're putting a Q-tip in there and it's like sandpaper scratching the very delicate lining of the ear canal, and it gets irritated and inflamed, it really creates an opening and an opportunity for the stuff that's naturally on your skin to get in there and and make things even more irritated.
The reason I use a Q-tip is to get the water out of my ear.
So for that, I would say you can use the Q-tip, but you would just kind of hold it to the outside so it can wick out the moisture.
Okay.
Don't put it inside.
Okay, I'll do that.
So yeah, I mean, Q-tip's great for kind of cleaning all the nooks and crannies of your outer ear. That's fine.
Yeah.
But then when you're trying to get the ear out, just hold it to the outside.
Okay.
It'll wick it out.
Okay.
Okay.
Excellent.
Yeah. So I guess if you can just take the Zyrtec, otherwise continue what you're doing, and you have some home tests you can use if you've got events coming up where you're still having symptoms and worried you might still be infectious. I am, just so you know, I will be touching base with infectious disease here to just say, hey, I got this case where, we've had a lingering positive test in a patient with CLL. They, but your symptoms have been improving nicely,
Right.
and are nearly resolved. But I don't think that they're going to recommend you, be testing with any regularity as long as things are getting better.
Right, okay.
I'm going to let them know our plan, make sure they give us the thumbs up.
Okay,
Okay?
I will do that, doctor. Thank you.
Nice to meet you.
Nice to meet you too. Thank you. I think I'm going the right way.
Yeah, there's actually a shortcut right to the front.
Well, I have to get my,
You're going back
my
to the way
driver.
down?
I have to get my driver.
Okay.
Thank you.
Yeah, all the way down.
Nothing wrong with me. I just have a little extra,
Yeah, I wish,
extra COVID in me.
that,
Yeah, and no metal.